Every day in my clinic, I have patients looking for help with their uterine fibroids multiple times per day, every day. We're going to go over all of the major symptoms and all of the subtle symptoms that someone may be coming to my office to see me and seeking help with their uterine fibroids. This is episode 2 of Fibroid Fridays. Now let's recap what happened in episode 1. Now we do know that fibroids are a non-cancerous cause of a uterine growth, and we talked about how common they can be. They can be up to 70-80% of all women in their menstrual years because, again, remember those fibroids, they love hormones and they love blood. But luckily, only about 25% of those are symptomatic. But those with symptoms, it can be pretty disruptive. And so we're going to take our time to go through these symptoms right now. My name is Eric Schmidt. I'm a board-certified OBGYN who specializes in minimally invasive gynecologic surgery and also robotic surgery. And what I want to do is educate you regarding uterine fibroids. We talked about in this episode, we're going to answer the question of what are the major and the subtle symptoms that uterine fibroids can give. And so let's start off with by far the number one symptom which patients are coming to see us for in clinic that have uterine fibroids is abnormal and heavy uterine bleeding. And what is normal bleeding? If you want to refer back, we did a whole podcast on this with Dr. Valieva, but normal bleeding would be about, to put a number to it, 80 milliliters of blood through that menstrual cycle, bleeding for approximately 5-7 days maximum, and on a somewhat regular cycle. And we say once per month, but that can vary a number of days, shorter or longer. And so abnormal bleeding would be beyond that. And so that's heavier cycles, prolonged cycles, and this can be because of uterine fibroids. Patients can bleed much heavier. They can bleed much longer or potential multiple times per month. What really matters a lot about how these uterine fibroids affect somebody's bleeding cycle depends on the size and the location of the fibroids. And we're probably actually going to get more detail about that in the next episode. And what these fibroids do, not only do they love hormones, but they love blood. And so they're going to bring more blood to the uterus. They give out these factors called, or these proteins, these factors called angiogenic factors. And what that does is tells the body to bring more blood vessels, bring more blood to that area. And so when we do surgery and we look at these uterine fibroids, they can have some pretty significant vasculature going to the uterine fibroids. And you can only imagine how much that would contribute to someone's symptoms when they're dealing with uterine fibroids. What these fibroids also do, and then we talked about in the previous episode, is that they are this hard, really fibrous tissue that doesn't allow the normal uterus tissue, the smooth muscle of the uterus, to really contract down and squeeze those blood vessels so that the bleeding decreases. And by the contractions, I mean the contractures of the smooth muscle is what actually gets some of these small blood vessels to stop bleeding. And so if there's this dense piece of tissue sitting in the uterus, it can't operate normally. And so that also contributes to the heavier bleeding. And another factor that contributes to the heavier bleeding can be associated with the inflammation that can come from the uterus. And that's actually symptom number 2, is that with these uterine fibroids there, it can cause increased dysmenorrhea or painful menses and increased inflammation, which can not only lead to heavier bleeding, but also can lead to lower pelvic, abdominal, back pain that can come with someone's menstrual bleeding. And point number 3 of the symptoms that uterine fibroids can cause is bulk symptoms. And now what this means is that these uterus fibroids are growing so big that they're actually starting to push on the surrounding structures. And the surrounding structures would be things like the bladder, the bowels, the nerves in the pelvis, the muscles, the tendons, the bones. And so sometimes, again, these fibroids can be very small, likely not causing these symptoms. And that could be like the size of a pea, a grape, a baseball, but usually bulk symptoms would come when they're getting much larger than that, potentially the size of oranges, grapefruit, potentially even like a basketball-sized structure can cause these bulk symptoms, but this isn't as consistent. And so generally if a patient's coming in with a smaller fibroid, we'd probably classify that as like a fibroid less than the size of a tennis ball. Those probably aren't causing these symptoms. These are usually fibroids much bigger. And not everyone that has these uterine fibroids has the bulk symptoms. We definitely get patients coming into us that have fibroids the size of a basketball that have no symptoms at all. And so this one's a little more complicated, and certainly if patient is having pain and they're found to have uterine fibroids and they're give or take the size of a strawberry or a grape, we're probably going to be looking for other sources of pain because that fibroid likely isn't going to be causing these bulk symptoms at that size. And so the next symptom that uterine fibroids can cause is infertility. Now, again, depending on location of the fibroids, the number of the fibroids, and the size of the fibroids, this could potentially lead to infertility if the inside of the uterus is distorted. Potentially the tubes are blocked by multiple large fibroids. And so this one definitely is a little more complicated, but something that can happen in rare situations. And to go a little bit along fibroids in relation to pregnancy, if someone does have larger fibroids and they become pregnant, they could potentially lead to some increased risks. Now, there are many women with fibroids that get pregnant, and generally it's not going to increase the risk of that pregnancy much at all. But please talk to your provider in regards to that. Some of the risk factors that could increase in pregnancy with larger fibroids would be things like preterm labor or pain during the pregnancy. Now, we talked about how fibroids generally don't cause a lot of pain, but there is actually one situation where they can cause actually a substantial amount of pain, and that's if the fibroids start to lose their blood flow. Again, they love blood flow, remember, but if the fibroid outgrows its blood flow, it's not getting enough, it can start to degenerate, and this can be quite a painful process, and again, this is more rare. But this would be quite a severe pain, maybe after a pregnancy where the uterus is shrinking down, the blood is decreasing to the uterus. This can happen, or other situations, but this can be quite painful and disruptive and definitely more acute. If you have any questions about this or any questions about episode 1, please comment down below, and we'd love to answer some of those questions. All right, everyone, those are the major symptoms and the more subtle symptoms that can come from uterine fibroids. And just to recap, by far and away, the most common symptom we have with uterine fibroids is abnormal, heavy bleeding, maybe irregular bleeding. Number 2, that would be pain-related symptoms. This can be dysmenorrhea or painful periods. This can be bulk-related symptoms. Again, these bulk-related symptoms is pretty rare. And along with the infertility is another result of uterine fibroids, again, more rare. And one of the more serious things is that acute degeneration of the fibroids that can happen, again, more rare. But by and far away, the biggest symptoms would be the bleeding. I hope you enjoyed this episode. Stay tuned next Friday. We're going to be talking about diagnosis and, again, the location of the fibroids and how that matters for their symptoms and their treatment going forward.